All right, 11 o'clock. Let's get started. Aloha, everyone. Welcome to another Dan and Friends. And we got some cool stuff to talk about today. A lot of you saw the press release that went out this morning pretty early. I think Elena sent it to all the staff, and we sent it, of course, to our medical providers and some of our other folks that we work with every day. We'll go over that. We'll also do a construction update, a lot going on. Some of you have seen some of the vendors and the contractors already on campus. We'll talk about that, our favorite subject, parking, and get the latest scoop. And then we'll also, I did get some questions back from you guys. We'll go over questions and so forth. So as usual, put your comments and chat in the box on the right. Nate will help us out here, and I'll see what I can get to. I know that he's coming out this morning. Some people may have not have seen it, and the word's just getting around. You may have questions and whatnot. So next week, probably toward most likely Thursday, I'll be traveling some here in the next couple of days, but we'll do another town hall and we'll kind of debrief on this one more time. So I'm just going to go all over what is a pretty significant milestone for us here at Hilo Medical Center. We've been working over the last couple of years a lot since the last legislative session with a potential donor. So Mark and Lynn Benoff are the owners they're the CEO and chair of this company called Salesforce, which, by the way, is the same company that does our intranet, does a lot of other services, but one of the big tech companies, biggest tech companies in the country. The Benoffs have lived on the island since 2000, and they, as much as they are business people, they're also philanthropists. They've given away to almost $1 billion over the last 10 years. And a huge amount of that has been to Hawaii, but a lot of it's been anonymous. And here recently, we got to know them, and they expressed interest in donating to Hilo Medical Center. They've been on the island quite a bit since COVID. This is probably their where they spend most of their time, and have gotten to know some of the work that we've done here at Hilo Medical Center, and especially over the years, really come to understand the needs of the neighbor island. And they did a reach out to us to, well, what would we need? How can they help? And I'm certainly simplifying a bit the process that you go through here, but we basically ended up to a point where they were willing to donate to our organization $50 million. And that is a very large amount of money. A piece of this came about during our whole process to get funding for our ICU and med-surg expansion, what we're calling HMC expansion. That $50 million CIP and that all the communication we put out as to why that was important, spurred interest in the Benoffs. They expressed some interest in potentially matching that amount. And over the course of the year, that actually became a reality. They also have been working with one of our other acute hospitals in the state, so Straub Medical Center. They've known Straub and have had a relationship with them, with the CEO of Hawaii Pacific Health for a number of years, and learned of their desire to build the new Straub Hospital. The reason I mentioned this, they also at the same time put together a donation of $100 million to Straub, and together made that donation official today. So a big deal for the island, and a big deal for the state when it comes to healthcare. So very excited about that, and also very appreciative to a lot of hard work and also the generosity of the Benoffs. So I'm going to go over some of the things that I think people would be asking. A lot of this is in the press release, it's in the documents that we shared with you, but I thought some of you would like to hear it from me. So what's the money going to be used for? So the money will be used primarily for, really for three different groups of things. The first thing is to help us finish the ICU. So the $50 million for the ICU that we got from our ledge is certainly the biggest portion of it, but the whole project's around $80 million. So $20 million of the Benihof's donation will go to help us finish out that project. We also, as you know, if you've been listening to town halls in the past, we have tried to figure out how to have a new family birthing center. Our obstetrics unit is 40 years old. They do a great job. Facilities dated, and the way we birth babies, we do it in kind of a fractured way, in the most, I guess, modern and up-to-date fashion. As you come in and you do your laboring, your delivery, your postpartum, all of that is in one very nice room where it's set up to have a great experience, because childbirth is a happy event. It's something that should be celebrated, and we were hopeful to be able to modernize our facility. We had to change course a bit. We ended up having to do the ICU in med-surg because the hospital was so full. But through this donation, we're able to now have the funds to build a new family birthing center within the hospital. And I'll spend some time at future town halls explaining how we're going to do that, but 15 million of that $50 million donation will go to that project. The remaining money will be spent on improving what we lack here, or providing what we lack here on the island, which is the ability to treat head trauma, neurosurgical, emergent neurosurgical problems in a prompt manner. Most of you know, if you hit your head severely here, we can't treat you for that. We have to get you to Oahu. At best, that's a 6-hour process, and sometimes that's too long. It reminds me a lot of the issues we had when it came to heart attacks and how we couldn't treat them timely. And over several years, a number of years of hard work, we were able to fill that gap. Well, with monies from this donation, we want to be able to fill that gap as well. Part of doing so requires us to recruit physicians. We have several areas where it's very difficult to get highly specialized docs here. We're going to use some of those funds to assist with physician recruitment, and also work with Straub, Hawaii Pacific Health, to, I guess, tap into their ability to bring in specialists. The last but not the least thing, and this is a little more complicated to explain, but as when we have donations come in, some of that money is used for projects where we already had planned to, or set aside some funds. Well, we're going to take some of those funds and use them for behavioral health services. We know that's a huge need in the community, and we basically are leveraging this donation to be able to do much more for our community, not just for East Hawaii, but hopefully this will greatly impact and improve the ability to give services across Hawaii Island. So it's an exciting event, something I think all of you should feel good about. I had to do different interviews and was asked what this donation meant and why it was important. And, in talking with the Benihofs and thinking about this, if you want to make people's lives better and you want to do that equally to almost everyone, spend your money on healthcare, because at one point or another, all of us, our kids, ourselves, we will need healthcare to save our loved ones, to make our lives better. And this donation helps us meet that mission. So I'm very excited about that. Certainly very grateful to the Ledge and to the governor and others for their support here recently, which I think gave impetus to this gift, and certainly for the leadership of our regional board, who are all members of this community and have helped support and make this possible. So probably getting some questions up here, and we'll take a look at them. Before I get into the questions, though, I want to talk about a couple other things that came with the donation. So part of receiving this money, both for Hilo Medical Center and for Straub, was that we would change the name. And I think that this is important in that this helps align us with the vision that the Benihofs have of really improving healthcare. Our hospital will become Hilo Benahoff Medical Center. Straub Hospital will become Straub Benahoff Medical Center. And we think that this is a good and positive alignment. We also think that this type of relationship will encourage us to collaborate and work more together as two acute hospitals in Hawaii with the same mission. But I also want to clarify, because I've already had people ask me this, we're not privatizing or becoming part of Hawaii Pacific Health. What we are doing is we agree as part of this shared donation to collaborate and to work together to improve healthcare for those who live on Hawaii Island. So there is instead of kind of this sometimes chaotic process to go from Hawaii Island or the Big Island to Oahu and to find the right care or the right specialist, that there's a pathway that we develop together so it's able to go smoothly and well so you can get access to the specialists that don't live here on the island. And ultimately, because of the Benahoff relationship with hospitals in San Francisco, if you can't get that specialist care covered at HPH, maybe uber specialists or very niche specialists, you can go to UCSF and there's a pathway. That's ultimately what we want to accomplish here. So if you live on the neighbor island, doesn't mean that you're stuck or limited when it comes to your care. And that's the advantage of being part of this group, this vision of hospitals that are associated with the Benahoffs, but specifically for us at Hawaii Pacific Health and UCSF. A lot of that is in the press release, but I hope that made sense to you guys. And as we work more on this, I'll explain and share with you as we move along. I know also some of you going to ask, well, when's the name change? What are the specifics? We're still working out the exact timing of that. Certainly there are agreements and there's steps that we have to follow. I don't know exactly when. It won't be too much longer from now. Will that affect some of your work? The names and the designations that are that are on some of your documents and some of our legal requirements to communicate. Sure, we'll have to work through all of that, but you'll get more information on that as we go along. So that was a whole lot to just kind of put out there, but I definitely wanted to share that with you myself personally. Let's see. So we have some questions up there, and assuming my eyesight is good, was the name change a requirement of the funds? And the short answer is yes. So the donation for both facilities, one of the stipulations of them was the name change. And in speaking with the Benahoffs about that, it was interesting. We were having I think a very open and transparent conversation about that. And what Mark Benahoff communicated to me was, they had given literally hundreds of millions of dollars to different causes in Hawaii and elsewhere anonymously. And they felt that the time had come to be public about doing so. And they went on to explain why that was. It says, when you have people, and we have a lot of uber wealthy people that live on this island, they said they're not always sure what cause to give to, how to give, where their money will be useful and well received. And when we go through the process of giving to an organization and doing so publicly, it gives permission. It encourages others to give and to support the good cause. And we felt like that this would be very beneficial. And because we live here and we care about this community, we want to put our name on something and support it. And I thought that was a good rationale, and I trust in their good intent. So we felt good about that. Our board felt good about it, and that's what we're going to do. So let's see, will the name change require legislature or state approval? So certainly before we sign any agreement, we do our homework here. The short answer is no. Our regional board has statutory authority that allows us to change the name of the hospital. We did check with our attorneys general and all the appropriate did the legal due diligence here. You can't name a state building after a business, but you can name it or include the name of a donor. As you know, many of the university buildings and others have their names on different the donors have put their names on different things that they funded, whether it be like the Scheidler School of Business, etc., being one example. So yes, we can do that. So by changing our name, does that mean they will continue to donate yearly? So a little just general information about the gift. It's to be distributed over 5 years. There are projects, the projects that I talked about that we need to complete, and the funds will come as we complete those projects. So there's responsibility on our side to do our hard work and to make sure that we use the money wisely. I mean, I just speak honestly, I hope to continue the relationship, and I hope that the Benioffs and their foundation believe that we are a good investment and this really helps people's lives, and they will continue to support us, which will allow us to, I think, to take our healthcare to a complete another level, which is really great for all of us that live here. So will we have input on the layout design of the new areas? If somebody's asking from OB, the short answer is yes, with the caveats. We have like a defined amount of space, and there's a general design that has to fit in that space, meaning you got to have so many rooms. For example, they have to be on a window wall, you have to do certain things. But within that design, the OB team and others will have input. I think a number of them were involved in our initial design of the Family Birthing Center, so we'll repeat that process, and hopefully we'll end up with a, an area that you all are really excited about. All right, I think that covered all the particular questions we have there. You can throw your questions up as Chris goes through her construction update. And by the way, she is welcoming every hard, difficult question about parking you can think of. Okay. All right. So I'm going to zoom out here, and we can go over here to Chris. And there you are. Have at it, girl.
All right. That is just queuing us up to get started. And I think everybody can see it. Great, perfect. All right, so we're gonna go through a couple of slides and talk about what's going on here at Eagle Medical Center and the construction efforts that are happening right now. So as always, let's start with aiming at the right screen here. All right. Okay, let's start with our most recent project, which is the Angio Holding Bays. So we had Kumu Alawai come by this morning, and he was able to bless the holding bays. This was about a 9-month project, and will serve the interventional radiology and angiography areas. So congratulations to that team. Next, all the banking that's here down at the Ohana Cafe. So the Ohana Cafe will be under construction for about 2 more weeks. We're expecting this to open on March 19th. And we've got new equipment going into the hotline and hopefully some new offerings in the Ohana Cafe. But a big thanks to our fan staff for feeding us those grab and goes as we move through the construction efforts here. Okay, so let's move a little further into the construction and the map that we will start walking through here in a moment. So I'm going to start chronologically because that will probably make the most sense with what is happening now and then what is going to be happening in the future. So we're going to follow the yellow arrows on the screen. So the first one is NAN's trailer. So those of you that parked in the upper lot have noticed that NAN has set a few trailers up on our campus, and that is to help their mobilization efforts. The next arrow is what is happening right now and started yesterday, which is the building of a new pedestrian walkway through the administration area, because that will be the new route for visitors from the upper lot. as well as starting on this barricade plan to keep everybody safe during our construction efforts. So we're expecting that to happen for about another week or so. Also, in the front of the hospital, there is a new lane that they're developing so they can put their crane in this front turnabout area as they build the building, and this will be a alternate access route. This will be an alternate access route for all of our visitors that drop off at the turnabout. Next week, we have some excavation work, and then finally, we have a little bit more parking work, and then finally, this entire red area will be barricaded off. All right, for those of you who are tuning in remotely, just some pictures for you. So we have the south lot, which is located in the visitor parking lot, or sorry, the employee parking lot. NAN has taken about an acre back there, and this is where they will be staging their equipment and also parking. So most of NAN's staff and all the construction crew should be parking back here in this graveled area. You can see in the distance some Jersey barriers that they're mobilizing so they can start with their construction plan. In the hospital turnabout, this was taken this morning. They're creating that lane and a small walkway. So we will be routing traffic through this lane and out onto Waianaemoili. And then the previous west wing lot is also barricaded mobilization area for NAN as they build those as they build the walkway into administration. I should say in front of administration. All right, so how does this affect everyone? And more importantly, how is this going to affect our parking? So again, I'm going to go chronologically with what's going to be happening first. So the first closure is the lower parking lot, and this is the Mauka section of the parking lot. This entire red area will be closed starting March 18th for the mobilization of our medical office building 3. We will lose 104 stalls. The visitor parking area will then move down to the Mackay lot, where we will designate 100 stalls for both the acute hospital and for clinic parking. So this again will happen March 18th. We have the maintenance crew that will be restriping or at least redirecting the arrows in this lot to make sure that visitors and our patients get out safely. All right, the medical office building 3 access route when we close the lot. So if you look at this picture, you can see in the background, this is the footprint of medical office building 3. The red area is the construction zone. So all of that will be closed off. This again is the parking lot that will service medical office building 3. I'm sorry, medical office building 1 and 2. And then this parking lot, which is above medical office building 1 or old HPOC parking lot, will still be open. All right, but the access route to get into the building, if you park in this lot, back one. Sorry, if you park in this lot, will be the lower entrance. So you'll be walking right past the construction zone, up the parking lot, and then into this access point right here between the 2 buildings. All right, so more parking closures. Moving back across the street to the acute campus, the area in red will be closed as of March 25th. So we will be moving the physician parking, and we will be closing kind of a good part of the upper lot on March 25th. ADA and restricted parking, so the parking that is along this side of the building and a few of the stalls that are designated here will be moving into this blue area. The sign stalls that are currently in this upper parking lot will be moved up, and then the rest of the lot will be retained for visitor parking. Physician parking will then be moved down to the Yukio lot. So this lot has already been striped bright green and has been marked physician parking area number, or I should say alphabet D. So there's 32 stalls here, and then there's also 2 on-call stalls that are designated in the lower parking lot. And just a reminder that MOB1 and MOB2 parking had opened on January 20th, where we have another 34 stalls across the street. So altogether, looking at our parking additions and just reminding everybody, we added about 270 stalls prior to these closures. We'll be closing just about 200 stalls. And during this time, we'll have a parking map. So this parking map will come out in about a week or so. where we will designate where patients can park and walk, where ADA parking has moved to. And then we are also looking at mobility impaired parking and possibly partnering with a valet service to provide a service for some people that needed extra help getting into the hospital. But all that will be coming again in a couple of weeks. Any questions on that?
You want to pull down and you should at least get a couple of hard questions.
I know.
Oh, here we go. No.
All right. Well, we will publish this out on the intranet and we'll get some parking maps out for everybody. But this is what's going to be happening in the next couple of weeks. And we just appreciate all of your help and support. Will the gravel lot still be open? Nikki, is that the gravel lot that we just opened? So it is that 177 stalls that we gravelled and striped, that will be open. Okay. Well, this one on the internet. Yeah, we'll put it on the internet. For everybody. Okay. That's all.
Nice job. Nice presentation. Let's just leave. We'll get to those questions here in a second. Just every time we do this discussion, I will just remind you all that we will all experience pain and annoyance and irritation and inconvenience. Okay, when we do these constructions, these construction projects, it does require moving a lot of cheese and changing people's routine. So I please ask you to be patient and understanding. We will have a really nice campus when we're all done with this, but to get through it, I think we all need to be thoughtful. And also, I strongly encourage you to follow the parking rules and others. They're meant to keep you safe, and they're also meant to make sure our patients can get parking and get in and get services. We've always talked about parking. We've probably been pretty easy on folks. We pretty much give them tickets and remind them stuff and maybe little nasty grams, but we will be enforcing our parking requirements, because if we let it get too loose, it won't work. So I'm just kind of giving everybody heads up here. Try not to push on the parking thing. We'll try to communicate well and be as thoughtful as we can, but we'll need to get through this together. I just want to throw that out there. So can we go up to that question on the ICU there, Nate? So there was one question about the press release mentioning our 19-bed ICU. Will that mean we'll have 30 ICU beds available? So I think what you're talking about is that if we build the 19 and we already have 11, will we operate 30? And the short answer is no. 30-bed ICU is pretty large, maybe one day, but we are building the ICU hopefully not to be full the day we open it. Our initial plan for the first year or so is to staff it to about 15, and then we'll gradually add the rest of the beds. Right now, preliminary planning, and again, preliminary can change, is that we will be utilizing the old ICU for potentially basically departments that are getting relocated to put OB in may end up in the ICU. Okay, so we're going to use all our space. We're figuring out how best to do it. And while we have a good idea, it's not quite ready for prime time. Okay, so, but good question. What's happening to the White House? Will there be parking? The White House?
The greenhouse.
You mean the former greenhouse?
The former
greenhouse. White House.
That's not a White House.
You can take a crack at that. It was also one of our questions here on the written. You want to do that?
Sure. So the long-term plan for that house, so we did purchase that property, and the long-term plan for that property is to create more parking and a turnabout that will tie MOB 1 and 2 together.
And the question that was on the one of the ones that were submitted was, would there be parking over there by the building where you're out of the rain? So we actually, in that whole front parking lot in front of the original medical office building 1, we'll have an awning built out so you can unload and load out of the rain. But to do that, we needed more space, which is where the former greenhouse comes in, to allow the parking to flow and turn around. So that's why we bought that building. We had an idea that we would really need it, and we will. So when are we going to do that? Right now, we're trying to get it all done as Medical Office Building 3, which starts here March 27th.
March 18th is the barricade plan.
March 18th. As that project finishes, we want to go ahead and do the parking on the other side and finish that project in its entirety. We don't want to leave little bits and pieces hanging out there. All right.
And we'll explain that in future projects where we'll explain the other projects that are supporting. So this is just a small part of what we're doing right now. There is a plan.
Next one is, are you identifying more administrative stalls in the lot near MOB 1 and 2 for providers working in the building? So I think Chris went over, if you pull up that map on the intranet, it will show you according to your colors. If you're a provider, you park at the neon green stall.
Neon green. So 1, 2, there's A, B, and C are the 3 lots, and then we did, or at least on that side of the campus, and we did count the number of providers in MOB 1 and 2, and they should have enough stalls.
So the administrative parking that's next to the new gravel lot. I know that some folks park in that section. It will stay, I believe, administrative parking for a while, but then we'll need it about a third of the way through the project. We'll actually close that area. And when we put up the steel that goes in the building, we'll use that area for laying all that down, and it's erected. And once that's done, we'll put those back in service. So hopefully we'll have enough available for everyone. I think after a while, you guys will get used to like where you can park and where you're not. It's just, we'll have to kind of ease into it here over the next month or so. Should we start to order a lot more citation stickers? Actually, I want to get away from citation stickers and basically either boot cars or tow people. And I have a feeling then people will pay attention. So I mean, I don't want to be a jerk about it, but that's why we talked about, before we just pretty much just gave people reminders. And for some folks, at times reminders aren't enough, and people will just often ignore them or take their decals off their cars, all that good stuff. Kind of know all the little tricks there. We have to manage parking tightly, or we won't be able to, again, run a good project and protect access for our patients. So just putting everybody on notice. Okay, let's just follow the rules here if we can. What about the parking by the VA? Why does it make the doctors? That want to go talk about that by the veterans? That is doctors parking.
Yeah, so that is the designated physician parking lot. So there's 32 stalls at the top of YO that the physicians will enter in through the ground floor by the morgue.
And if you're talking about that area that's directly outside of what we call the back entrance or the morgue entrance, it's a very tight, and there are people that are coming back and forth across that walkway. We decided that that parking lot shouldn't be a lot of in and out. It should be mostly in the morning, and then people leave. Again, we'll figure this out and make adjustments as we go through, and we'll see if some things are working or not. So I'm sure you guys can give feedback, and we will ask you guys what you think. All right. Will there be some designated spots for midnight shift, for mid shift staff? So want to take that one?
Yes, so right now for mid shift, so the 11 to 7, so the 11 to 7 staff there are we did create a program where you can put a placard on your windshield that you can park in the upper lot in the back row of the upper lot. I'm not sure if that still is well communicated, but we will look at mid shift parking as a part of this plan.
So for some of you guys that work like an 11A to 11P, after 5 p.m., you can park anywhere. I mean, meaning that you can, and then it's kind of a bummer, but you can use your break and go out and move your car if you want it to be closer to the hospital. 7A to 7P, if you park in the gravel, but most of you guys will find parking closer to the hospital if you work the 7A to 7P, because you usually come to work about 6:30. The 8 o'clock folks that start, they generally have to park further away, but they're usually done before it gets dark. So please keep giving us your feedback. If we need to make sure we have some designated mid-shift area, we can do that. Again, the numbers of you guys are kind of on the small side, but I still know that that's important. So yeah, keep the information coming. All right. What about parking lot? We did that one. Let's see. Be greeters to, so will there be greeters to assist mobility impaired and whether and wheelchair bound patients, the market MOB 1 and 2. So the plan right now, again, we're going to keep working at it, is the small lot that's right in front of MOB 1, right in front of the oncology center there, will be designated for wheelchair or ADA handicap stickers. And I think we're going to keep 3 stalls in there for urgent care, but the rest of it, you only park there if you're handicapped. Okay. So we will have someone supervising that parking lot, and you also can drop off and pick up in there. Okay. But you can't park there the whole time unless you have a handicap sticker. And yes, we will have an attendant there to make sure that happens, because it won't by itself. I think we also are going to have the parking in front of the greenhouse also be for patients, but you know, it's a little tricky on the gravel side. That probably will be more for urgent care or maybe people dropping off. So we also know that it's a pretty long walk from the parking on the east side of the building to get into MOB 2. You have to walk around and go up that area between the buildings. So we're looking at potentially attendance or the ability to call and have wheelchair assist. So we are planning to spend money on greeters and support staff, additional security, and then for the main hospital, we are seriously looking at valet. By the way, if we do valet, odds are we're not going to keep it after construction, but we are looking at it. Okay. All right. Good. I think that's it. All right. So I'll run through the questions. We're up on, what is it? Is it 11:47? 37. Oh, good. We're not doing too bad here. We should take us about 10 more minutes. Speaking of parking, there was always questions about bike parking and motorcycle parking and so forth. As far as potentially having stalls that are designated in the parking lot for motorcycles or e-bikes and so forth, I think we can take a look at that. Not that many people ride motorcycles. I haven't seen. We had a couple of folks who were regulars, and but I think they quit riding. But we can certainly take a look at that. Or access to bike parking close to the building or a lot on the building is rapidly changing because we're changing up our entrances. So we're going to need to look at that. We have some places to lock up bikes, but it's not necessarily what some people would prefer. But we'll still keep trying to find the balance and make that work. At a question, will staff get a survey on administration? And so I think this is because we've pushed out all the internal customer surveys, which, by the way, please complete, and then you are eligible for lots of free ice cream. We really want to know how we're treating each other, which is, by the way, the point of those surveys. We need to treat each other as well as we treat our patients. And if you don't measure your satisfaction, then how do you know how you're doing, right? But the question of survey on administration is absolutely, you get a survey, and every year you get an employee engagement survey, which has, I think, about 8 or 10 questions that are about your favorite administration. So please fill those out and, you know, tell us what you're thinking about how we're doing. I think most of this particular question was about MOB 1 and 2 parking, and we already covered that. But one was, will Medical Office Building 3 or MOB 3 block the windows at MOB 2 and take away the chemo room garden? So the short answer is yes, it will. There aren't windows on that side to block on the second floor. On the first floor, you will still maintain the garden. However, right after the garden will be the next building. So that one was tricky. We had ideas that we would build a third office building, but we weren't 100%. And so we went with our plan. So you'll have a garden, but it'll be kind of shady. So, but we talked a lot about that, but there really wasn't a way to use that space, which is not a huge space, without blocking the view. So Medical Office Building 3, though, will have more windows because we made a point of making sure we had more windows in MOB 3. Question of why don't we accept American Express for paying in the Ohana Cafe? And I'm 80 to 90% sure that the reason is that they charge very high fees to process their credit transactions because the vendor, that would be us, has to pay a certain percentage on every transaction. And American Express is pretty high. So I think that's why we don't take American Express. That's why a lot of vendors don't take American Express. There was like 3 different questions on hazard pay and when you guys would see it and why haven't you seen it yet? So one person mentioned, well, if you worked at Maui, you would have gotten your hazard pay. So specifically, if you work in Maui County government, you would have gotten your hazard pay. I don't believe there was hazard pay paid by Maui Health System, which is a part of Kaiser. You'd have to work for Maui County. Maui County came out really early and did a settlement arrangement with HGEA, and they paid their hazard pay. No other entity, meaning like like the state or the other counties or the city of Honolulu, all those guys, I believe have completed their negotiations with their unions. So for some reason, Maui just did it really early. Again, no one else has done that. We haven't done it, and there's a reason we haven't. So there is I can just tell you straight up, I do think everybody, I shouldn't say everyone, I think there will be hazard pay paid. Okay, it's clearly in the contract. The question that has to be negotiated and arbitrated is how much, meaning what level, and then to who, and then for how much of the time, right? So all those things have to be worked out. And it's not just for, Hilo Medical Center, it's for all of HHSC, it's for Department of Health, it's for the counties, all those different workers, right? Because we have one big public employees union. So they are working through this particular process. Our goal as HHSC is to be part of the agreement with the state, various departments of the state. So not to be hanging out here by ourselves. We want to basically participate in the state's negotiation with the public union to decide what's fair. Because what we don't want to end up being is like, well, why wasn't I treated like this group? And why wasn't he treated like, over here like this group? And what, am I not important? Was not my sacrifice or my hazard more or less? We really don't want to turn this into a divisive issue. So hopefully there'll be a good, fair settlement that works out of that. And then additionally, how it's funded, we don't want hazard pay settlements to basically just pull money out of healthcare, right? That doesn't help you or I or our families. We want it to be a separate thing that hopefully the state and others figure out how to appropriately pay. And that also has to be done, by legislative action. I doubt that I don't think that will be addressed this year, but I'm not a legislator. But I do think that eventually hazard pay will be paid. I really couldn't tell you exactly when, but I thought it would be fair to share kind of this, I guess, for lack of a better word, the process or the strategy that we've been following to address this issue. That's a long explanation, but there were at least 4 questions out of all of our questions about this. So I hope that made sense to you guys. Um, Another question about speed bumps and additional crosswalks. We have 2 functioning crosswalks within 50, 100 yards of each other. The county keeps pointing that out to me, how many crosswalks and flashing lights you need. Seriously, they go, it's not so far for our employees to walk across the parking, the crosswalks, flip the lights, do these. And I've been asked straight up, isn't the issue is that your employees ignore the crosswalks? And the short answer is yes, that is. Because I mean, I've been guilty of it myself. You know, you see it's you just cross the road, or you go down to where the cars drive in and out, where the fences aren't, and you cross there. If you're an ECD, you park it, you go across at the very end. So in fairness to the county and the people that use Wainui, you can't have too many crosswalks because that slows the flow of traffic. So we've been discussing about, could we put in other things to slow the traffic and to make it a bit more safer. A bit more safe. The issue though is we need to follow the rules and use crosswalks, okay? So it's not to say that we won't keep working on maybe putting things such as what those tabletop speed tables, which Chris is not a fan of, but some people like and some people don't. Some people say if you got good shocks, you ignore them, they don't slow down. So we know that there's a lot of traffic moving back and forth across that street. We're trying to work with the county, who ultimately has the decision, not us, as to what can be done about it. I would just encourage you to, hey, look both ways and use the crosswalks. You know, kind of like what your parents would have told you, perhaps. So pharmacy had a question. With all the anticipated expansion of the hospital, will there be more expansion or room for storage for ancillary department supplies, equipment, medications, etc.? I'll just address that question in general. So we are very aware that we have stuffed people everywhere. We can stuff people, and we've stuffed stuff about everywhere we can put stuff. How's that for English? But bottom line is we are really jammed up here. So I won't get all into it today, but part of our expansion in building does include, within the same time frame we're building all of these projects, an administrative services building on where the West Wing was. What that will do is pull a lot of staff who are currently in storage spaces that are doing dual services offices into an administrative services building that will be a much better arrangement for everyone. I'll just tell you, I appreciate everyone being flexible about moving every other year and being jammed into tiny spaces and being too friendly with your coworkers. I get it, but I just will remind you it's for a good cause, and we do have a plan to make it better. Okay. I think that we're almost, yeah, one question here, why don't we offer more options for hospital week? I think more selection is really the way I read the question. So we generally have stuck to just 3 gifts, and we understand that they don't meet everyone's needs, but we gave out 1,900 presents last year. We try to make them all roughly of the same value, somewhere around 40, 50 bucks, which is a pretty dang nice gift. And we also decided we weren't going to give away junk, which is like $5 gifts that people look at them, use them once and throw them away, because it's kind of a waste. So we concentrated the selection, made it smaller and made it more expensive, and hopefully that you would get a lot of use out of it. And I mean, I see our gifts, our jackets and scrubs all over the hospital. So I'm hopeful that's in the long run, maybe a better use of our money, your money. So that's why you don't get so many selections. The other reason it's really difficult to actually get gifts out to people if you've got 10 different choices. The logistics of it actually are pretty difficult to do that. So you asked a question, and that was the reason. And I think that does it.
Question on the new conference rooms. Are we building a conference room? So that was a little bit addressed in that discussion on that administrative building that we're hoping to build following the expansion. But in the meantime, it is going to be a trailer park station out in front of the medical center. So we are placing another, I think it's a 20 by 40 container, trailer. Modular complex, out there just for some relief for our, specifically for our conference room.
So we'll have a trailer, I believe it's 40 by 60.
I don't think it's 60. Oh, no, it is. It is 60. I don't know if it's 40.
I think it's 40 by 60, but we're having a debate. So hey, for those of you who have ever lived in a trailer, okay, it's a double wide. We're gonna put a double wide out there for a conference room. Okay, so that will help some. In the new expansion, there are, I think, 2 conference rooms on the 2nd floor, and I think there's one on the 3rd. There's one on the 3rd, and we also in the long range plan, like our ground conference rooms are being used for offices as we are able to build the administrative services building. We hope to get the ground conference rooms back and put them back in their original purpose. All right. And Nadia said 24 by 60.
24 by 60.
Well,
you just say 40 by 60?
I wanted it to be. So 24 by 60. So that's, we should be able to have a decent size conference room.
I think it's about the size of the learning center right now. That's what we spaced it as.
Yeah. All right. So if classes are moved off campus, will HMC provide transportation or will they pay employees? I think we'll have to work through the details of this. If, for example, you have to come to work, you need to go to a ACLS class all day and it's, I don't know what UH. You would just drive to UH. There'd be no point of you driving here and turning around and then transporting yourself there and vice versa, because it's UH is within the same general vicinity as Hilo Medical Center. Now, on the other hand, if it was a partial day or something, we probably have to work through some of the logistics of that. So we're not looking to off-site things, because we have some of our staff now that actually work in off-site clinics and we don't pay them to come to HMC and then transport them to the clinics. They go to the clinics and work. So we'll work through that process as our collective bargaining agreements require us to do so. There you go. Well, this was a bunch of information in this meeting. I would say this probably is one of our more fun-filled and fact-filled, hopefully fact-filled meetings. I will schedule another one for next week. So if you have questions, please, we'll send out a request and you guys can respond. And as we go through construction, I think we committed to communicate regularly. So I'm thinking probably every 2 weeks we'll have a town hall of some sort. Some may just be construction updates. Some may be that other things, because sometimes you don't have enough to talk about in 2 weeks. But I think construction will keep us busy. So again, we'll do that. So thank you for everything you do. Appreciate all your guys' support and care for our community. And so you guys have a great day. Aloha.